Over the last several weeks of quarantine due to the coronavirus, the U.S. economy has been virtually shut down. In fact, the global economy has been shut down. Despite a massive government stimulus package, unemployment requests are at an all-time high. And it seems uncertain when or if the economy will fully recover. What is the moral and ethical way to fight a public health crisis while also maintaining a nation's economic vitality? To address all of this is our old friend. He's president of the Acton Institute and frequent world over guest, Father Robert Sirico. Welcome back. Father, as an economist and a priest, I want to get your take on this choice to essentially shut down the U.S. economy as an answer to a public health crisis. Now, this is Dr. Anthony Fauci from earlier this week. Listen and react.
I mean, if you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there.
Was it really necessary, Father, in this case, to sacrifice the economy, the lifeblood of every man, woman, and child, for a virus to protect against this healthcare crisis?
One of the first things I think we need to do is resist this dichotomizing, this radical separation of the economy from human beings, because after all, the economy is for human beings. The human person is the center of the economy. The economy emerges out of human action, out of human decision making. So it's as crazy to say we should just forget about and not worry about the capacity of this virus to spread its contagion and just go about our lives without any concern, as it is to say the economy is unimportant. Both of these things have to go together. And I think what complexifies this and what makes it so confusing for us is when we look at the issue from a central planning perspective. You notice how quickly it's the government, the central government, the health bureaucracies that take charge of this thing. When in point of fact, in Michigan, for instance, in our part of Michigan, here in Grand Rapids, I know that our hospitals are not full at this point. In Detroit, they may be very overburdened, but to treat Michigan as one entity is asking for trouble.
Now, since economic health, as you mentioned, and public health are so interconnected, how can we take a both-and approach to this coronavirus pandemic? I mean, a healthy economy is vital to maintaining the health of the community. How long can you lock down America and Europe?
Well, ultimately, you can't, because people will die even at greater numbers. The fact of the matter is that a healthy economy breeds public health in general. Richer economies, richer societies, richer people and families are generally healthier than poorer people and families. And so what we need to do is find a way to allow businesses to flourish without threatening the well-being of people. And you do that by knowing what you're confronting. The regulations that inhibit the production of various kinds of treatments for this, the various kinds of tests, the masks, the safety capability of people, all of these are governed by health regulations that inhibit. I could go down a list, I have a whole list here, of companies that can produce masks, that can produce sanitizers. Distilleries can produce sanitizers. But the law doesn't allow them to, or now it's beginning to loosen up because of the desperate situation we're facing. So we have to free the economy.
Trump eradicated a lot of those, to try to get those companies to respond. And it's the private sector that's bailed us out in many cases, certainly with the protective equipment and the speed with which some of these pharmaceuticals have become available, hydroxychloroquine and other pills. Now, Father, Korea flattened the curve without closing businesses. They just maintained social distance. They wore masks, greater hygiene. Why couldn't the U.S. follow that model?
And they tested. And that's what we have to do. We have to release the mechanisms. The stimulus packages, to a very great extent, a fraud. What it does is it attempts to give us fiat checks, which are as ultimately as deleterious to the economy as a whole as fiat money. We have jammed ourselves in this situation because of the Federal Reserve System and other World Bank and other things. And what we need to do is free the economy. We don't need fiat jobs. We need real jobs, jobs that serve people. You know, in all of this, there's a real lesson about the dignity of work, that we see that simple work, grocery store clerks, garbage people, are so essential for human well-being.
Yeah, yeah. I mean, I do think we now, as we see some of these numbers begin to, crest, you see that there are hospital beds in many communities. And let's face it, you're safer at an nearly abandoned office building than you are at a grocery where everybody in the community is swarming daily. Isn't there a risk in everything we do? Vaping and drinking and eating. The fact is, obesity and diabetes seem to play a big role in the lethality of this disease. So the question is, how do we balance the need to want to keep people safe and not spread contagion with the necessity of going forward with our lives in every way?
I think you let things be organized at the most lowest level of their existence, where people know the situation. The response to this, the question of business in Grand Rapids, has to be different than the response in Detroit. And in New York, I'm told that the ship Mercy is not even full, that the Javits Center is not full. Now, I don't understand this from the news reports, how desperate the situation there if those two major hospitals are not full.
Well, because a lot of the models were wrong. I mean, we have to admit, a lot of the models the government was using, New York was claiming they needed 40,000 respirators. Ended up they didn't need anything near that. In fact, now they're deploying them to other parts of the country. Good. And here in New Orleans, we're one of the big hot spots. We have two field hospitals, one in a hotel, one at the convention center. The convention center only has 23 people who are recovering. They're not even active cases.
Remarkable.
Here's my question. Historically, you've written a great piece on what the church's reaction to pandemics and plagues have been in the past. What is that? How has the church reacted in the past, and are we reacting the same way now?
Well, there have been two kind of reactions that I've detected in history. One is what I'll call the mission reaction. That is where people will go and associate themselves with the dying, and even at times become contaminated themselves. We have many accounts throughout history of, in fact, the hospital itself as an institution emerged from this kind of proximity to the poor and to the dying. But you also have a kind of fervored religious piety that ignores the reality on the ground. So that, for instance, in the 16th century, there was this plague and they had a big procession, and the procession ended up extending the contamination. So we have to balance these tensions and recognize that when people are dying, they need the care and the comfort that the church and her sacraments offer to people. And it's a real pity that in some of the hospitals across the country, these have been prohibited.
I want to move on to the question of returning to normal, that after this pause, we'll go back to normal. Here's the president from the other day.
Let's win this and let's get our country open as soon as we can. I think it's going to be sooner than people think. Things are going really well. Again, light at the end of the tunnel.
Father, in your estimation, how much permanent damage has been done to the economy? And can we honestly expect small and medium-sized businesses to survive this and recover?
Well, how much damage will have been done to the economy is yet to be told, because it's going to depend, for instance, on the kind of tax levels that are going to be imposed. I still do not know, and I haven't heard any discussion about the possibility of a tax holiday for businesses. If you want to release their energy, I think, wouldn't that be wonderful to say from now until the end of the year, businesses don't have to pay tax, people don't have to pay tax. So I think we could extend the damage that's done. Of course, we're going to approach this whole matter very differently, especially in the immediate aftermath, because we're more aware of contagion. We're more aware of sanitation.
Yeah. Yeah. Well, Father Sirico, we will leave you there. You can follow the work of the Acton Institute and Father Robert Sirico's columns at acton.org. Happy Easter, Father.
Thank you. Same to you.